Most men assume that high testosterone levels are a sign of optimal health. Most guys have it in their head that more is better. That just isn't always the case, however, and it's especially true with testosterone. To protect and preserve your wellness, it's only necessary to have testosterone levels in the normal range. Still, men across the globe are turning to OTC testosterone supplements that purport to boost testosterone levels sky high, presumably to help men feel stronger and sexier. Our hormone clinic does not recommend that men artificially increase their testosterone levels above the normal range. This vastly increases the risk of side effects even when using pharmaceutical-grade testosterone, and the use of over-the-counter testosterone supplements only increases the chances further. Clinical research shows that having testosterone levels in the healthy range is optimal, and there are no serious benefits to amplifying your testosterone levels further, beyond simply increased muscle mass. There is still a lot of institutional debate regarding what is officially considered the normal range for testosterone, but the consensus is that T levels between 300 and 1,000 nanograms per deciliter are ideal. To date, there are still questions being asked regarding the benefits of being at the top of this range versus being at the bottom. At this time, all signs suggest that there is only a minimal difference in wellness between those toward the bottom of the healthy testosterone span and its highest bound. Dr. Basin of Harvard Medical School agrees. He says that libido and energy are most profoundly affected by those with testosterone production below 300 nanograms per deciliter. Recent research published by the Journal of the American Medical Association examined the difference in the effects of testosterone replacement for patients with clinically low testosterone, average 230 nanograms per deciliter, to those that received HRT treatment in the low but normal range, 300 plus. Both groups received testosterone replacement therapy sufficient to boost testosterone to 500 nanograms per deciliter. The low testosterone group experienced significant benefits in fatigue reduction and sex drive, while those in the low normal range experienced no such tangible benefit. There is one particular area where testosterone treatments have an impact regardless of starting testosterone levels: muscle mass. Testosterone injections, patches, and creams have a proven anabolic effect on muscle mass, which makes it popular among those that want to improve strength and muscle mass. While this may be the case, the risks associated with artificially high testosterone levels are much more significant than the benefits. On the other hand, amplifying testosterone in this way does not benefit elderly men in areas which are most important, specifically with regard to general mobility. There are lots of things that cause testosterone production to drop. Chronic inflammation can tap stores of important testosterone precursors. Obesity converts existing testosterone into estrogen compounds. Even being around your kids can have a suppressive impact on testosterone production, likely for evolutionary reasons. In general, though, we all experience the same pathway of testosterone decline. Testosterone production plateaus during the 20s before finally beginning a progressive decline from age 30 onward. Testosterone production falls by around 1% per year, not enough to notice in a year or even 5 years, but it can eventually have an impact depending on your physiological baseline testosterone production. Low testosterone is a relatively common medical issue for aging men, affecting around 5% of guys in their 50s, contributing primarily to problems like fatigue and low sex drive. Currently, the FDA gives explicit approval for men with testosterone levels below 300 nanograms per deciliter to initiate testosterone therapy. Some men lose testosterone production because of illness, disease, or trauma. Others need testosterone because aging has depleted their ability to produce testosterone. Most insurance companies cover testosterone replacement therapy as long as the patient is experiencing symptoms and testosterone levels are verified twice before low-T treatment is prescribed. The Endocrine Society agrees with the FDA's guidelines as of March 2018 and strongly recommends that men at high risk for prostate cancer or those that have had a heart attack or stroke in the last 6 months not take testosterone. While the FDA suggests that bioidentical testosterone only be used by patients with testosterone levels below 300 nanograms per deciliter, these recommendations are not legally binding, and doctors are urged to prescribe testosterone at their discretion. Many doctors choose to prescribe testosterone to men that display the symptoms of testosterone deficiency, even if hormone testing shows that they are in the normal range. For example, some men report sexual and metabolic benefits from testosterone at T levels as high as 450 nanograms per deciliter. Of course, for these patients, there may be a placebo effect at play. In the end, it's up to you and your doctor whether testosterone is right for you. Our licensed hormone clinic offers comprehensive metabolic testing for low T and other forms of hormone imbalance. If our tests reveal that you may be a candidate for testosterone therapy, we provide a range of low T treatment options designed to boost your vitality and maximize your quality of life. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding hormone replacement therapy, please click the link below in the description.